Well, thank you, Paul, and thank you everybody for that warm introduction. And thank you to the members of the Chamber for inviting me for this discussion today. I'm going to go ahead and share my screen, so bear with me as I do that. And also, I ask that you sort of bear with me as I get through the little bit of the first slide jitters as I work my voice out here for this presentation. Can everybody see these slides okay?
Yep, looks good.
Good. So today I really want to focus on some key items. The first being, I think it's really beneficial just to discuss exactly what Livingspace is, as I know there's a lot of misperceptions existing in the community. Secondly, I want to pick up on some themes that were discussed by Brian during this February 10th presentation to the Chamber and link his thoughts to our work underway at Livingspace currently. And then finally, I want to provide some examples of how Livingspace is contributing to the local economy and outline some of the projects in development for 2021. And then, of course, I'll leave some time at the end for questions. So I want to discuss a few of the themes that really stood out for me from Brian's discussion on February 10th. The first being that serving homelessness is expensive, but ending it creates return on investment. He highlighted that the cost of homelessness in Canada in 2007 was $4.5 billion. And as of 2013, this had risen to $7.05 billion annually. This accounts for the inclusion of, emergency shelter costs, community supports, but also includes, everything from emergency services like fire, police, EMS, to healthcare, and, the criminal justice system. He also spoke of the flawed policies that focused on serving homelessness instead of ending homelessness, and how the delivery of emergency services, is self-perpetuating and keeps people in a state of homelessness, resulting in an increase in trauma and injury and a chance of substance abuse, and ultimately requires more access of those emergency services. The second theme that he really spoke to was the fact that solutions to ending homelessness require cross-sectoral collaboration. He spoke about systems being the problems that need to be addressed that are driving the route to homelessness. He referenced the At Home and Chez Soi study, which highlights the successes and the reduced costs and the better outcomes of providing services from a housing first approach. And he spoke to the fact that it is cheaper to keep people housed and support them in that housing than to respond to homelessness once they end up in an emergency shelter. And then finally, he spoke to the benefits that come from ending homelessness for our community, and those include direct, indirect, and recouping lost opportunity. So what is Livingspace? Well, Livingspace is a registered charity dedicated to ending homelessness in Timmins by providing services, shelter, project coordination, and planning. The organization was created through the hard work of passionate community partners who came together in 2017 under a common goal to hold each other accountable to ending homelessness in Timmins. Livingspace is both a strategic partnership as well as a physical space. The aim of the partnership is to end chronic homelessness in Timmins by 2025 through the realignment and coordination of services. These services are made available to the community through the physical location of Livingspace. Ending homelessness in Timmins means working collaboratively across sectors to respond to the local priorities and address barriers that inhibit the prevention and elimination of homelessness. In May 2019, Livingspace opened its doors as the first 24/7, 365 free emergency shelter in Timmins and created a community hub that really looks to bridge the gap to make services more accessible for those experiencing or at risk of experiencing homelessness. Since, Livingspace has supported over 200 individuals with moving from chronic homelessness into permanent housing with supports. All Livingspace programs adhere to the values and approaches of equity-based access, harm reduction, culturally safe, housing-focused, and trauma-informed care. And Livingspace's logo features the gap, which is a symbol often used to tell others that you're safe here. And Livingspace is just that, a safe place for people to turn to. So the most important element of Livingspace is the strategic partnership that's designed to hold partners accountable to each other and to the goal of ending homelessness. This focus on collaborative and strategic partnerships takes place throughout the organization and starts at the governance level. As such, the board of directors includes senior leadership from important stakeholders such as the Timmins Police, the DSAB, CMHA, the Timmins Native Friendship Center, and others. Livingspace participates on and leads a number of local committees, including to the Timmins Area Drug Strategy, the Mental Health and Addictions Planning Table, Community Mobilization Timmins, or the Situation Table. In all of at the service level, Livingspace works to maintain partnerships with organizations that play a role in supporting people experiencing homelessness. This includes organizations like South Cochrane Addiction Services, NAN Legal, the hospital, and others. So really, Livingspace strives to promote grassroots volunteer organizations like the Yo-Mobile and Project Love or Pad Patrol, in helping to create opportunities for those programs to do their amazing work. We recognize that the importance of this work done by the hundreds of volunteers throughout the community is important and is really at the bedrock of ending homelessness. Timmins.CARE is an important initiative in the community that highlights this great work being done throughout Timmins. At the systems level, Livingspace participates in important groups such as Built for Zero Canada, Reaching Home Canada, and the Shelter Transformation Network. So the strategic partnership, and participation in local committees that I just discussed is important as it lays the groundwork for the collaborative models of care that takes place out of the Livingspace Hub. So on a weekly basis, despite the COVID challenges that we've seen over the last year, Livingspace sees the following community partners attending the community hub to outreach to people experiencing or at risk of experiencing homelessness. So on a weekly basis, we have doctors attending for our primary care clinic. We have nurse practitioners or social workers attending from the hospital's community withdrawal management program. We have foot care, dental care, chiropractic care, hygienic care, all through local private companies like Rainville Health or Pearly White Plus, providing services on site. We have daily access to trauma-informed counseling via video, phone, or in-person support through CAS Clinical. And we have daily visits from mental health workers from CMHA, workers from South Cochrane Addiction Services, the Friendship Center, and others. Overall, in 2020, Livingspace had over 40,000 individual contacts through the housing programs, over 15,000 health services visits, completed over 1,000 referrals for treatment or other supports, and engaged with over 50 people who were sleeping rough around sheltered outside. So as you can see from the list of programs on the slide, we have grown significantly since the initial overnight drop-in shelter launched in 2018. This growth was designed to improve access to supports that contributes to the process of moving people out of homelessness and brings Timmins one step closer to our goal of ending homelessness by 2025. And then finally, Livingspace is a community partner, participating in volunteer coordination, advocacy and awareness, fundraising development, project coordination, and in total, we collaborate with over 20 unique partners to promote access to supports for people experiencing or at risk of experiencing homelessness. So before we go any further, I think it's important that we stop and review the importance of having a clear understanding of the definition of homelessness through a local lens. So homelessness describes a situation of an individual or family without stable, permanent, appropriate housing or the immediate prospect, means, or ability of acquiring it. It is a result of systemic or societal barriers, a lack of affordable and appropriate housing, or the individual or household's financial, mental, cognitive, behavior, or physical challenges, and or racism and discrimination. Most people do not choose to be homeless, and the experience is generally negative, unpleasant, stressful, and distressing. The problem of homelessness and housing exclusion refers to the failure of society to ensure that adequate systems, funding, and supports are in place so that all people, even in crisis situations, have access to housing. The goal of ending homelessness is to ensure housing stability, which means people have a fixed address and housing that is appropriate, meaning affordable, safe, adequately maintained, accessible, and suitable in size for their use, and includes the required supportive services as needed, such as income supports, mental health counseling, or whatever the person might need. Without a clear and inclusive definition of homelessness, homelessness can easily get narrowly defined to include, people in homeless shelters or mainstream homeless services, and exclude people who may be hidden homeless or outside those systems. So homelessness really encompasses a range of physical living situations, from unsheltered, emergency sheltered, provisionally accommodated, or at risk of homelessness. And on this slide, I have an image of Jesse Thistle's book, From the Ashes, which is a really important book in the homelessness field that speaks to the importance of defining homelessness locally and through an Indigenous and lived experience perspective. And it's important to note that there is no single cause that explains everyone's experience of homelessness, and pathways into and pathways out of homelessness are neither linear nor uniform. Individuals and families who wind up homeless may not share much in common with each other, aside from the fact that they are extremely vulnerable and lack adequate housing and income and the necessary supports to ensure they stay housed. So homelessness is really the outcome of a complex and intricate interplay between structural factors, systems failures, and individual circumstances. For any given individual, homelessness is usually the result of a cumulative impact of a number of different factors rather than a single cause. These factors and the interplay between them not only help us to understand the factors that put people at risk of homelessness, but also point to where our preventative efforts must lie. So if we look at structural factors first, these are really the broad systemic, economic, and societal issues that occur at a societal level and affect opportunities, social environments, and outcomes for individuals. Key structural factors can include issues related to poverty, discrimination, lack of affordable housing, or the impact of colonialism on Indigenous people. Systems failures, on the other hand, refer to those situations where inadequate policy and service delivery contributes to the likelihood that someone will become homeless. System failures that contribute to homelessness occur when individuals and families experience barriers to accessing public systems, failed transitions from publicly funded institutions and systems, and silos and gaps both within and between government-funded departments and systems, and also within nonprofit sectors. And then finally, we have individual and relational factors, which include things such as crisis, housing insecurity, interpersonal and relational problems, persistent and disabling conditions, interpersonal violence, or trauma. So knowing this, why is Livingspace so committed to systems integration? Well, first of all, Livingspace cannot solve homelessness in Timmins alone. It's a community issue that requires a community-wide response. And secondly, the issue affecting people who are homeless are intersectional and require the support of diverse systems addressing the root issues through a coordinated and strategic approach that creates sustainable change. So if we look at the three factors that from the previous slide of structural, systems, and individual circumstances, we really see that Livingspace can sort of make the most impact on two of those, which is the structural and the systems failures, by taking a systems integration approach. Doing this improves people's ability to manage their individual factors that are contributing to their homelessness. And the Livingspace Service Hub is really central to removing away some of these key barriers that prevent people from moving out of homelessness. So here's just an image of some of the services available at the Centralized Service Hub. As you can see, we've really expanded from our initial offering of just an overnight shelter. And in addition to sort of the benefits of the Centralized Service Hub, such as in cost savings or removal of barriers from people accessing support, we also really gained a better understanding of the local context and profile of homelessness. So in 2011, an enumeration study was done that allowed us to identify that there were 720 people experiencing homelessness in Timmins. From that, 219 people were experiencing absolute homelessness in Timmins. In 2018, a period prevalence count was conducted that allowed us to get a better picture, once again, of the people who are experiencing homelessness in our community. So from this study, we learned that there was a high percentage of people experiencing chronic homelessness, a high percentage of Indigenous people experiencing homelessness, and that the gender divide was almost evenly split. But the Centralized Service Hub also sort of as we better created programs to meet the needs of the people accessing our services, it definitely drove up the use of these services. So as we see on this graph, from 2019, when we opened our services 24/7 in May, there was a drastic increase in the amount of people who were moving from chronic homelessness or sleeping on couches or other provisionally accommodated scenarios into homelessness and access and resources. So through our operations in 2019 and 2020, it allowed us to again create a bigger and a better picture of what homelessness looked like locally. And as we implemented coordinated access and intake strategies, it improved our data collection and sharing amongst stakeholders, which again led to the development of a by names list and further insight into those experiencing homelessness in Timmins. So what we really learned over the last few years is that the profile of homelessness really is, people experiencing complex issues that require a multifaceted approach. And all of this information and data allowed us to sort of move away from the existing model of providing support for people experiencing homelessness. That kind of looks like the image I have on the screen now. So what we see is a lot of people trying to navigate a complex system to get to a few select resources. And usually what was happening was that, it depended on, having the best case manager or knowing how to, work the system or pull whatever strings that you need to do to get into housing. By implementing coordinated access strategies and better data collection models, it's allowed us to move forward on more of an approach as we see on the slide now, which allows us to move people in a coordinated way, prioritize based on their need, and then match them with the right sort of housing at the right time. And, coordinated access and this idea of matching resources for the highest need and for at the right time isn't unique to homelessness and housing. We see the same thing with the approach being taken by the community mobilization and the situation table, where they're really trying to make sure that resources are mobilized in a way that they get maximum impact and that we're not really duplicating services. So what exactly is coordinated access and what does it look like for Timmins? This is a good, infographic that explains some of the key steps, which include having access points where people can engage in the system, comprehensive and assessment intakes that really look at the complete picture of why somebody becomes homeless, prioritizing based on need and the individual's strengths, and then matching with the proper services and referrals in the community. And here's an image of what is the coordinated access system that's being developed in Timmins over the last few years. So as we'll see, there's a few icons that have the Livingspace logo above them and a few circles. So the purple circles are really the areas that are being addressed through the Housing Now and other local coordinated access partnerships. And the red circles are really some of those priority areas for Livingspace. So you'll see that we already have emergency supports for people and outreach supports for people who are experiencing homelessness, but we really need to start focusing on some of those prevention activities and access to treatments and supports. So as we've gained a better understanding of who is homeless and the barriers preventing them from remaining housed, it allowed us to focus our system advocacy on a few key issues. And this includes the overdose crisis, the fentanyl crisis, and the development of coordinated supports and responses for people in crisis. And this allows us to make sure that those people who are accessing living space for supports are really have all those other supports that they might need in place to successfully move forward on their housing placement. And as we address homelessness strategically by really focusing in on those high acuity needs, those experiencing chronic homelessness, it's allowed us to reinvest some of our resources into some more preventative or upstream approaches that will really contribute to ending homelessness by 2025 in Timmins. But it's also allowed us to divert people with low acuity away from having to access emergency services in the first place, which is really important because if we make sure that only those people who are in the most need are ending up in our emergency shelter, it really allows us to make the best use of the limited amount of resources while making sure that someone who hasn't been touched by crisis yet or hasn't been as much touched by crisis is diverted away from that system. So we know that Livingspace contributes to the local economy. Since 2017, we've contributed over 5 million to the local economy. We've hosted 2 regional summits. We've spent over 2 million on local property developments in the construction industry. We spent over 1 million on local services and businesses, and we've attracted over 4 million in new investments to ending homelessness in Timmins since 2019. And I think this last point is really important. Because the funding that Livingspace receives from the federal level and much of the funding we receive from the provincial level is new to the community. This isn't money that's taken away from other services in the community. This is money that we've gone out, competed for, and then brought to the community to better respond to our needs. And we also know that Livingspace contributes to the local job development system. We've created over 30 full-time and over 40 part-time jobs since 2019, over 20 student placements opportunities with the local colleges. We've hired 4 people directly from our services through our vocational program. And in all of the Livingspace programs really follow that living wage standards as one of our primary objectives is poverty reduction. So we also know that Livingspace contributes to our community. So our hub model, not only does it create efficiency and cost savings associated with emergency services like police, EMS, but it's also led to some interesting developments such as the mobile crisis response team with TPS. We also know that we've reduced the need for people to engage in negative or illegal behaviors to secure housing or support their addictions. We know that by bringing people into supports and creating that community, they're less likely to engage in those negative behaviors. And finally, we know that we've reduced the health and societal harms associated with the opiate crisis through our advocacy work through the Timmins Area Drug Strategy, the Opiate Response Strategy, but also, quite frankly, through the fact that throughout this overdose crisis and this fentanyl crisis, we are not seeing people who are homeless passing away from overdoses. That's not an accident. That's purposeful. And that really reflects on the supports we have in place at Livingspace so that when somebody's in crisis, we can get them in touch with the supports they need immediately before more damage is done. And then finally, we know that Livingspace contributes to social return on investment for our community. And we do this through decreased emergency response costs, improved opportunities for community participation, increased engagement in preventative supports, and decreased impacts from the criminalization of poverty. So I want to just highlight a few of the exciting new projects being developed with many diverse stakeholders here in Timmins that really draws upon the value and knowledge of people with lived experience of homelessness, trauma, and substance use to promote this idea of social inclusion while creating opportunities for meaningful work. So there's an interesting project coming together between Livingspace and a few other community partners and stakeholders that we're calling the Pathway to Potential Project. And it's a strengths-based, recovery-oriented program that's designed to support people experiencing homelessness to connect with meaningful work, whether that's paid employment, volunteer activities, whatever the person's really looking for. And the program really builds upon the successes that we've already demonstrated through Livingspace's existing peer-lived experience programs and the innovative approaches we're seeing with our vocational program. So the project really has a few key phases. The first phase will focus on developing employment skills for people, while the second phase will really focus on expanding those opportunities for people. So in the first phase, we're looking at opportunities to help with litter cleanup in the downtown core, snow removal assistance for businesses in the wintertime, maintenance and enhancement of the BIA projects in the downtown, supporting the Anti-Hunger Coalition with the maintenance of their gardens, and creating more peer positions and lived experience positions at Livingspace and the Salvation Army. Like I said, phase 2 is hoping to build upon this to create more unique opportunities for people. In this program, it's not new. It's based on successful programs like One City Peterborough, Guelph's Welcoming Streets Initiative, London.CARE's or Oshawa's Welcoming Streets Pilot program. So we know it works, and we know that it's a good way to engage people who are experiencing homelessness or at risk of homelessness in activities that helps to promote that social inclusion and be seen as a member of our community rather than as an other.